Hi, I'm Too Cute with sensational living and, of course, living a sensational life. In order to live a sensational life, some things just have to kind of come about to take care of old injuries because we're getting older, or things that we need to start paying attention to that we know neglected before but are coming to light with age. One of the things that happened to me was at the age of 45, I decided that I wanted to have children. Well, during that time, I went to the doctor and the doctor told me that that time was over. So what I needed to do was have a hysterectomy. Oh my gosh, he is a doctor, okay? So he proceeded to give me a full hysterectomy and I no longer could have children. Later on, I met Miss Marjorie Coley, who introduced me to UFE. UFE is a procedure that's done instead of a hysterectomy, where I probably would not have had that invasive surgery. So, right now, we're here talking to Dr. Neel Patel.
Hi.
Say hi.
How are you? Hi.
And he's going to inform us about this procedure because so many women need to know about it, not only for themselves, but their mothers, their daughters, their friends. So, Dr. Patel, tell us a little something about yourself.
Yeah, I'm a vascular and interventional radiologist, and I do minimally invasive procedures, and these minimally invasive procedures help try to avoid surgery. And one of the main treatments I do is for uterine fibroids, and so I'm just hearing your story. That's typically, fibroids are these non-cancerous growths that happen in women's uterus, and they can cause certain symptoms. Common symptom is heavy menstrual bleeding, and these fibroids tend to grow in your late 30s and 40s, and then they kind of shrink down when you go into menopause mostly. Sometimes it doesn't. Talking about who's affected by fibroids, it's common amongst certain demographics. African American women, Hispanic women, and Asian women have a higher incidence of getting fibroids, but it is also present in Caucasian population also.
Is there a reason that it's more prominent in people of color?
There's no, it's just, it's been linked to an enzyme that creates the fibroids, but it's just, it's a hereditary type thing, and it's not exactly known why it happens in those certain demographics, but it's also, a lot of people who have fibroids may have a family history of it, like their mother's sisters or mother's sisters may have it, and so those are the populations who are more affected by it.
I've been hearing about fibroids for years and years, and like you said, our mothers, grandmothers, they've had it, but there have been procedures where I've heard of where they can reduce sometimes the tumors.
Yeah, correct. And some first-line treatment, medication, sometimes hormones. Surgical treatment has traditionally been hysterectomy, myomectomy. Myomectomy is where you go in and surgically remove a fibroid or several fibroids, and hysterectomy is where you completely remove the uterus. The procedure I do has been around for 20 years, uterine fibroid embolization, and it's a minimally invasive procedure where the incision's only 5 millimeters in size. We go into the arteries that feed the fibroids, and we inject these tiny, tiny beads that block the blood supply to the fibroids. And all living tissue in our bodies needs oxygen, and so these beads block the oxygen, causing the fibroids to have a heart attack and die.
Okay, now I did a little bit of homework. So sometimes you go in through the arm?
Yeah, I do a newer technique. This, traditionally this procedure's been done through the groin artery, and I do a newer technique where I go through the wrist artery, which is called the radial artery, and we use these long catheters that go all the way from your arm down to the pelvis, and then we go into the arteries that feed the fibroids, and then we cut off the blood supply to it. The incision is only 5 millimeters in size, and it's kind of like if you've ever had an IV, it's that type of catheter, but it's longer, and we're not in the vein; we're actually in the artery.
Okay, all right.
So, yeah.
So how long does that take? I mean, how would you go about knowing that what kind of procedure works best for your patient? Because you have several procedures, a couple different ways to do that, and then how do you know which one to use?
Yeah, so it's a combination of your symptoms and age, and also, what I do is I tend to get a MRI. Most fibroids are diagnosed usually by getting a pelvic ultrasound. In addition to the ultrasound, I order an MRI of the pelvis, and that gives better detail of the fibroids. Lots of times I've had multiple patients say I have like 1 or 2 fibroids on the ultrasound, and I do the MRI, and they have like 6, 7, 8. So the MRI is very sensitive to picking up very small fibroids. It's not always the size of the fibroids correlates with your symptoms, so it's location of the fibroids. In the uterus, you have 3 layers. There's an outer layer, a middle layer, and an inner layer. And so different symptoms can occur depending where these fibroids are located.
So many women are having hysterectomies these days. I mean, is this something, a practice that most gynecologists would use, or you have to be a specialist, or how does that work?
So there's, a lot of hysterectomies are being performed. This procedure is a good alternative for many. Sometimes hysterectomy is a choice, but lots of times doing this procedure can save you from having surgery. And recovery time is about a week versus surgeries, around 4 to 6 weeks. So I have a lot of patients who are working, and they don't want to take 6 weeks off from work. So this is a good alternative.
When I had my hysterectomy, I went back to work after about 2.5 weeks, and the women there were like, "Go home, go home." When I have and it's become something that women expect to have at some point. So when I have my hysterectomy, I'm taking all 6 of my weeks off. So you need to go home. You're not setting no precedents here, Yeah. So it's amazing that women feel that they will get to that point where once they hear that the doctors say, well, you need to have a hysterectomy, they've already kind of let themselves feel like it was going to happen anyway. So they don't look to get any other
alternatives.
Yes,
yeah.
Any alternatives, or a second opinion.
Yeah.
But are you certified to do this outside of being a gynecologist, or I mean, how do you look for a doctor that does this?
Yeah, I am certified to do this, even though my specialty is interventional radiology.
Okay.
We do a lot of minimally invasive procedures, vascular surgery type procedures. Finding, it's just a lot of my patients have, they've done research on the internet, and that's how they come to me, and they've been told they need hysterectomy or myomectomy, and then they kind of do their research, and then that's how. That's the main thing, is just be informed or do your own research.
But how do you look for something like that? I mean, what do you look for? What do you research? What's the word that you're going to Google?
It's uterine fibroid embolization, or it's.
Yeah, but if we don't know anything about it.
Yeah.
How would I?
Hysterectomy alternatives.
Alternative to hysterectomy. Okay.
Yeah, so that can give you a lot of information. It's kind of just a lot of, I take for a grain of salt some of the information on the web, but you know, I always tell my patients to be, you know, fully informed, and kind of, it's good, I like it when they come in with information.
Well, there's a large group of women that are going to want to know more about this.
Mm-hmm.
And we do a lot of networking in the Atlanta area. Mm-hmm. And would it be possible that we could absolutely get you in and do a presentation and give us some more information on it?
Yeah, I'd love to. You know, it's my passion to help educate women on who have fibroids, and, you know, make sure they have an informed decision before they do anything. So it's fun to.
Not to mention, just coming in and getting an exam, you'll be close to this one. Is he not adorable? Is he not adorable? Very few men make me wish I was younger. This one does. But I think that if you would give us a call, or if you would just go ahead. My name is Too Cute, Tukute. Contact me. If you Google me as Too Cute, you're going to find a whole list of things. So you can just contact me from anywhere. But it is Too Cute, Tukute, at toocute.net, or Too Cute, Tukute, presents at gmail.com. My website is toocute.net. So there's several different ways that you could get a hold of me. And I'm on Instagram, I'm on Facebook, I'm on Twitter, however. But I think that you want to go to your sisters, your mother, your grandmother, your daughters, and yourself. And let's get the word out about this. Let's make sure that everybody understands that this procedure is available, that we no longer have to have invasive surgeries. We do have an alternative. Let's get educated. I want to thank Dr. Patel for giving us this information today. And let me know if you would like to come to a presentation so that Dr. Patel can give you more information, or it's Neel, Neel Patel, Dr. Neel Patel. Look him up yourself and come and look at him. But thank you so much. Wow. This is the recovery area. So you have your own private little space. So they can bring their earphones.
Dr. Neel Patel, and this is our procedure room where we perform our minimally invasive procedures.
Wow, Dr. Patel. Woo! Now, would I be scared in here? Would you hold my hand?
Yes, I will.
That makes it worth coming. Hi, I'm Too Cute. I'm here at a wine event and I'm showing off my new wine charm. It matches my outfit. So, do you have your wine charm? Don't go to a wine tasting without one.
Hi, I'm Dr. Neel Patel. I'm a vascular and interventional radiologist, and I'm here to help you live a sensational life.